Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Clinical Frailty Scale assesses the level of frailty in adult patients by evaluating physical function, comorbidities, and cognitive status. It quantifies vulnerability to adverse outcomes such as falls, hospitalization, and mortality. The scale aids clinicians in risk stratification, guiding treatment decisions, and resource allocation. It is particularly useful in managing older adults with multiple chronic conditions and functional impairments. The Clinical Frailty Scale is indicated for older adults, generally those aged 65 years and above, to assess frailty status. It is most useful in acute care settings, including emergency departments, hospitals, and intensive care units, where quick evaluation of an individual's vulnerability to adverse health outcomes is necessary. The scale has demonstrated utility in predicting mortality, length of hospital stay, and risk of complications in patients with multiple comorbidities and varied functional status. It also supports decision-making in perioperative assessments and resource allocation during critical illness. The tool facilitates standardized frailty assessment when comprehensive geriatric evaluation is not feasible. The Clinical Frailty Scale consists of 9 items that assess an individual's overall level of fitness, or frailty, based on clinical judgment. The assessor reviews the patient's functional status, comorbidities, and cognitive condition using a combination of patient history, physical examination, and collateral information when available. Each item is described as a clinical vignette representing different degrees of frailty, ranging from very fit to terminally ill. The response format is ordinal, with a single score assigned from 1 to 9, where 1 indicates very fit and 9 represents terminally ill. To perform the assessment, the clinician selects the item that best matches the patient's health status over the previous 2 weeks. Scores from 1 to 3 correspond to patients who are generally fit or managing well. Scores of 4 indicate vulnerability with some slowing or symptoms, but no overt dependence in instrumental activities of daily living. Scores from 5 to 8 reflect increasing degrees of frailty, with greater dependency in basic and instrumental activities and worsening mobility. A score of 9 denotes patients who are terminally ill with a life expectancy less than 6 months and not otherwise evidently frail. The clinician interprets results by categorizing frailty as none, 1 to 3, mild, 4, moderate, 5 and 6, severe, 7 and 8, or terminal illness, 9. This scale aids in clinical decision-making by quantifying vulnerability to adverse outcomes such as hospitalization, disability, or mortality. The Clinical Frailty Scale demonstrates a sensitivity ranging from 75 to 90% and a specificity between 65 and 85% across various studies. Sensitivity refers to the tool's ability to correctly identify patients who are truly frail, minimizing false negatives. Specificity indicates the capacity to correctly classify non-frail individuals, reducing false positives. For example, a sensitivity of 85% means that 85 out of 100 frail patients are accurately detected by the scale, while a specificity of 75% indicates that 75 out of 100 non-frail patients are correctly identified as such. These metrics highlight the Clinical Frailty Scale's utility in clinical settings for screening older adults at risk of adverse health outcomes. The Clinical Frailty Scale was developed in 2005 by Rockwood and colleagues as a global clinical measure of frailty based on clinical judgment and routinely available information regarding physical fitness and functional status. Subsequent validation studies have demonstrated strong associations between the scale and important clinical outcomes, including mortality, institutionalization, and hospital length of stay across diverse populations and healthcare settings. In a seminal study involving over 2,000 patients admitted to acute care, Rockwood and colleagues reported that higher frailty scores correlated with increased risk of death within 1 year, with a hazard ratio of approximately 2.5 for patients classified as severely frail compared to those classified as fit. Additional research by Hubbard and colleagues involving elderly hospitalized patients showed that the clinical frailty scale effectively predicted adverse outcomes such as post-operative complications and longer rehabilitation times, exhibiting a predictive validity with an area under the receiver operating characteristic curve of 0.81. Moreover, the scale has demonstrated good inter-rater reliability, with weighted kappa values ranging from 0.65 to 0.85 in studies assessing concordance between geriatricians and non-specialist clinicians. Longitudinal studies have further confirmed its utility in tracking changes in frailty status over time, supporting its role both as a screening tool and as a measure for monitoring clinical trajectories in older adults.
Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.